Now, looking at the next vein right here, which we'll be discussing its anatomy. This is what is known as the internal iliac vein. Internal iliac vein. Okay, so this is the internal iliac vein. All right, and looking at this image right here too, this is the what? Well, the internal iliac vein is not here, but just that it's within this, just that it's not, labeled, but you can work with this. Okay, so internal iliac vein, just so you know, is a major pelvic vein, and it drains blood from the pelvic organs, the pelvic wall, the gluteal region, the perineum, and it ascends alongside the internal iliac artery, and it joins the external iliac vein at the pelvic vein brim. Okay, so this is the internal iliac vein. Okay, the internal one should be the internal. Okay, the one outside, of course, that's the external iliac. So so that when it joins them, it joins the external iliac, it becomes a common iliac, right? So it's formed by a union of multiple tributaries from the pelvic organs and walls. Now it runs superiorly and posteriorly within the pelvis. So it lies posteriorly and medial to the internal iliac artery. So it ends at the pelvic brim, where it unites with the external iliac vein to become the common iliac. So it communicates with blood vessels that give branches to what? That's basically vesical veins, the ones that goes to the bladder, rectal veins, uterine veins, vaginal veins, prostatic veins. So they'll drain those areas that I'm listing. Then parietal tributaries is the gluteal veins, the obturator veins, the lateral sacral veins, then the iliolumbar veins. So this is just the relations. It's positioned near the pelvic organs and all of that. It's closely associated with pelvic fascia and the lymphatic vessels. So the blood drainage, it drains blood from pelvic organs like the bladder, the rectum, the uterus, the vagina, the prostate. Drains blood from pelvic walls. Okay, drains blood from the perineum too. So clinical significance is involved. We'll actually learn about the anatomy so that we get to fully understand the basis of all those pelvic venous plexus. Then know about the surgical relevance. Then know about the collateral circulation, the various branches around there, and also the risks of thrombosis developing.